আসসালামাইকুম আজকে আমরা আলোচনা করব প্লুরা। সো ফার্স্ট হোয়াট ইজ প্লুরা? প্লুরা একটা হচ্ছে ক্লোজ সেরাস স্যাক থ্রু হুইচ লাং ইনভ্যাজিনেট ফ্রম ইটস মিডিয়াল সাইড। হিয়ার দ্য লাং bud which invaginate into the closed serous sac. This is actually a closed serous sac, and the lung bud expand gradually which reduce this serous sac. Here we can see the lung bud expand and which reduce the serous sac and converted into a potential space. So we have to know what does it mean, serous sac. Serous sac means the sac which is lined by flattened epithelium. It is also known as mesothelium. There are other serous sac present in our body like peritoneum, pericardium. This pleura has two layers. The outer layer is known as the parietal pleura and the inner one is known as the visceral pleura, which intimately attached with the surface of the viscera. And these two layers continuous with each other at the root of the lung. Here we have to know what is root of the lung. Root of the lung are actually the structure which enter into the lung or emerges from the lung and connect the lung with the mediastinal structure. And this structure, this root are passes through a triangular area. That area is known as the hilum of the lung. Here we can see there are some structure. This structure are the root of the lung, and this triangular area, this area is known as the hilum of the lung. And in between the two layer, parietal layer and the visceral layer, there is a narrow space which is known as the pleural cavity. And this cavity actually have a little amount, that is 5 to 10 ml of tissue fluid, which helps to lubricate in between these two layers during the movements of the lung during inspiration, and it prevent the friction. We know the two layers of the pleura, that is parietal and visceral pleura, continuous with each other at the root of the lung, and they also continuous with each other at the pulmonary ligament. Here we can see a cuff of pleural reflection. This is known as the pulmonary ligament. The visceral pleura is intimately adhere with the viscera, and it entirely covers the viscera of the lung, and it's absent along the hilum of the lung as well as along the attachment of the pulmonary ligament. And we cannot separate the pulmonary pleura from the viscera. And the pulmonary pleura or visceral pleura also extend into the depth of the fissure of the lung. Here we can see these are the fissure, oblique fissure, horizontal fissure, and the pulmonary pleura extend up to the depth of the fissure. Even the shininess of the lung is due to the visceral pleura. Now come to the parietal pleura. Parietal pleura, it actually covers the pulmonary cavity, that is it lines the thoracic wall and the lateral aspect of the mediastinum. It also covers the thoracic surface of the diaphragm. And here we can see the parietal pleura also cover the apex of the lung, which is known as the cervical pleura. Here we have to know the parietal pleura is subdivided into 4 parts according to their presence of some structure. Here we can say the portion of the parietal pleura which cover the apex of the lung in the neck region is known as the cervical pleura, and which lies under the ribs and their intercostal spaces, and in front here the sternum is removed. It's also covered the sternum, and behind it also covered the lateral aspect of the vertebra, that is known as the costal pleura. And the part which lies on the lateral border or lateral aspect of the mediastinum is known as the mediastinal pleura, and which lies above the diaphragm is known as the diaphragmatic pleura. So there are total 4 subdivisions of the parietal pleura. They are cervical pleura, costal pleura, mediastinal pleura, and diaphragmatic pleura as well. Here we can see another picture. The blue color structure is actually represent the pleura. Here the part of the parietal pleura, the portion which lies above the first rib, this is known as the cervical pleura, and the portion which lies beneath the ribs with their costal cartilages, intercostal space, and which cover the inner surface of the sternum in front. This is actually the costal pleura. If we see another figure on the posterior aspect, from the posterior aspect, this costal pleura also cover the lateral aspect of the body of the vertebra also. So this is costal pleura. This is costal pleura as it belong the under the rib. So this name is the costal pleura. Here the costal pleura is cut from here. This was the costal pleura, and the part this is actually the diaphragm, and the pleural parietal pleura which cover the thoracic surface of the diaphragm is known as the diaphragmatic pleura. Okay, and here the heart is removed, and the sternum is removed towards the heart, and towards the mediastinum. The pleura situated that pleura was mediastinal pleura, and here we cannot see the cervical pleura. So the costal pleura continuous with the mediastinal pleura. This is known as the costo-mediastinal line of reflection. This line is known as the costo-mediastinal line of reflection. Here we can see in the left lung also the costo-mediastinal reflection. And this line of reflection is known as the, where the costal pleura is continuous with the diaphragmatic pleura, this line of reflection is known as the costo-diaphragmatic line of reflection. If we see from the posterior aspect, this costal pleura also continuous with the mediastinal pleura along the vertebral body, lateral aspect of the vertebral body. This line of reflection is known as the costo-vertebral line of reflection. So we can say this line of reflection is known as the costo-mediastinal line of reflection. This line of reflection is known as the costo-diaphragmatic line of reflection, and in the posterior aspect, this line of reflection, pleural reflection, is known as the costo-vertebral line of reflection. Here the pleura is reflected or continuous with each other. Now come to the diaphragmatic pleura. Laterally, this one is the diaphragmatic pleura. Laterally, it is continuous with the costal pleura, and medially it is continuous with the mediastinal pleura. Now the cervical pleura, which extend from the inner border of the first rib to cover the apex of the lung, then it descend down. It is a first costal cartilage. From the first costal cartilage, it is lies 3 to 4 centimeter. Its apex lies 3 to 4 centimeter from here, and from the this one is the clavicle, and from the sternal end, this is sternum. From the sternal end of the clavicle, it's situated 2.5 centimeter from this sternal end of the clavicle. And the cervical pleura never extend beyond the neck of the first rib. The cervical pleura additionally covered by a musculoaponeurotic. Here we can see this is a cervical pleura, and externally it is additionally protected by a structure. This musculoaponeurotic structure is known as the suprapleural membrane as it lies superiorly. So the name is the suprapleural membrane or Simpson's fascia. What is it? It's actually the musculoaponeurotic structure. The muscular part is derived from the scalenus minimus muscle, and the aponeurotic part is derived from the endothoracic fascia. And that endothoracic fascia also separate the costal pleura from this structure, from the rib with its costal cartilages, intercostal space in between them, and the sternum behind the vertebral body as well. So we can say the endothoracic fascia separate the costal pleura from the structure overlaying it, and it also give protection to the apex of the lung. So the apex of the lung is strengthened by, that is, cervical pleura is also protected by another musculoaponeurotic structure that is known as the Simpson's fascia or suprapleural membrane. Now we can see the attachment of the Simpson's fascia. In front it is attached with the inner border of the first rib, and behind it is attached with the transverse process of the seventh cervical vertebra, and medially it is continuous with the pretracheal fascia. So this dome-shaped musculoaponeurotic structure, that is suprapleural membrane, it is very important for your written question for the short note. Now come to the mediastinal pleura. Here we can see here this portion, actually this portion towards the mediastinum, this is the mediastinal pleura, and the portion which is removed here of the pleura, that was the costal pleura. Okay, so now come to the mediastinal pleura. Mediastinal pleura is divided into subdivision. It has three subdivision. So here it is the hilum. So above the hilum, at the hilum, and below the hilum. Above the hilum, anteriorly it is extend from the posterior surface of the sternum and up to the vertebral lateral portion of the vertebral body. So it forms a transverse slit antero-posteriorly. And at the hilum, it forms a tubular sheet and which passes laterally to enclose the lung root.